personal attendant log for the Age and Disabled Waiver Program. This first section over here is going to be your participant name. And then for the training document, her name is going to be Very G. This is the block that I fill out that tells you how many hours and what days of the week that they want a worker in their home. This section is going to be a 6-month period of when the plan of care or your worksheet is going to be good. Your service hours tells you how many hours they can have up to a month. In this case, it's going to be 94 to 124 hours a month, which is 5.5 hours a day. When you see the change in hours or days or activities, that is if their plan of care changes. This is everything that I do in these 2 blocks, so you won't have nothing to do in those blocks. If I update the worksheet or something changes, the case manager fills this out. The most important part for you is going to be your service time in and your service time out. That's when you show up to work and when you leave work. For this example, it's going to be 10 a.m. and you're going to leave at 1:30. You're going to have your month that your care plan starts and the year, and then the days that you work, or the date that you work. So if you're going to work on the 22nd, you would fill in straight down the column. You're going to arrive at 10 o'clock. You would put 10 a.m. And when you leave, you would put 1:30. All right, total hours is going to be 3.5. And so you can put that 3.5 in your total hours block. And of course on the computer, on the actual paper, it's not going to do this, so just bear with me. All right, the next block, it says PA initial, 1 staff per recipient. All this means is there's only 1 caregiver in at the one time in the home. So there can't be 2 caregivers working for the same patient. This is where you're going to initial, saying that you're the only one working for that member or your participant. So you would put your initials there. Okay, the next block is the participant's initial. They're going to either be called your member, your client. State prefers a participant, and this is where they sign. When they initial this, they're initialing that everything you've done that day is true and accurate. Okay. The next block is going to be straight down. It's going to be where you're going to initial every day. And the description of what you're doing that day, or your to-do list, is over on the left, and it's bath. You'll see P is circled, and that means partial assistance. And then I'm describing what they told me that they need help with. And it says assist with laying out supplies, which could be towels, washcloths, anything they need laid out. You're going to do that every day. You're going to monitor safely during a shower, and that they use a shower bench and they have grab bars in the bathroom. You're going to monitor that the task is completed safely. You may assist with drying off their lower extremities. So you're going to either do all of this, some of it, or part of it. And if you do that, then you can put your initials in on that day that you completed that task. State says that personal care has to be done every day. So even if they prefer to take their bath at night, and that's perfectly fine, but you can lay out their towels and washcloths and get everything ready so that they can take their bath. State says assisting them in some way. So even that qualifies as you giving them a bath. Your next task is going to be skincare. And again, you're going to see P is circled, and that means they need partial assist. You're going to monitor for skin breakdown daily, lotion after bathing, and to their feet, and they use Gold Bond. So I'm describing to you what they want done for their skincare. And so if you set their bottle of lotion out beside them for later that evening, then you can initial that you assisted them in skincare. The next task is going to be hair, and it's circled partial, and it's assist washing in sink when she doesn't shower, and you're going to comb and style it daily. So if she didn't take a shower and she didn't want to wash her hair in the sink and you helped her comb it, then you can initial that task that you assisted her. Your next section is going to be nails, and again, it's partial assist. You're going to inspect daily for cleanliness. This is going to be done on everybody. Everybody should be able to check their nails to make sure that there's no dirt and grime underneath their fingernails. It says borderline diabetic, so you do not trim. And you're going to do this daily so you can initial that you've done nail care. Your next task is going to be mouth care. It's partial assist. I'm letting you know that she has dentures and it's uppers. Soaks and brushes herself, and you're just going to monitor tasks completed, prompt, and remind that she done them. So you're just going to ask her, have you brushed your teeth today? Do you have your dentures? Do you need me to help you with anything? So when you do that, you can initial. The next task is going to be dressing, and she needs partial assist, and she's told me that she needs assist laying clothes out, her shirts over her head. She needs help with buttons, snaps, and zippers, and her shoes and socks. So if you come in and she's already dressed, but she doesn't have her shoes and socks out, then if you help her with that, you've helped with her dressing. So any part of that you assist her in, you can initial that you've done that task. Next, you're going to go down to ambulation, and she is a partial assist. She uses a rollator. She holds onto the walls and the furniture and the fixtures when not using her rollator, and she's a fall risk, and this is a daily task. State says that if you need assistance in any way, then that is a partial assist. When you see someone getting up and they're walking around and they hold onto the furniture or the walls so that they don't fall, that's assistance, and so you can initial that you've seen them ambulate. The next one is going to be transfer. She is a partial assist. She pushes off the furniture or fixtures, assists with standing up and sitting down. She uses a rollator, and it's standby assist times 1, and she's a fall risk. Standby assist times 1 means you're close enough to grab her in case she starts to fall. So you can't be across the room or in another room if she's up and walking. So you need to be close enough to her that if she starts to fall, you can grab her. Or if you have to help her up with one arm to help her up out of the chair. Or if she has a lift chair. There's all assist in transferring. Toileting is going to be your next task, and you'll see she's partial. You have to offer to assist with the transfer on and off the toilet. She uses a bedside commode at night, and you're going to monitor for proper hygiene, okay? And remember, she's a fall risk, so she could fall if she went to the bathroom by herself. Stand close enough to be able to help her if she needs it. And so now you can mark that she went to the bathroom and she did that safely. Positioning is non-applicable in this situation because she's up and about. This is mostly for patients who can't get up out of bed. So you just leave that one blank. So you're going to go to the medication prompt. You're going to remind daily. As assistants, you're not allowed caregivers to mess with their medicines. All you're going to do is say, have you taken your medicines today? You don't have to witness her. You don't have to, she can take them before you get there. As long as you asked and reminded her to take her medicines, you can initial it. The next one is going to be meals. It's going to tell you if she's on any special diet or any special directions. Usually it's breakfast and lunch since you're there between 10 and 1:30. If she likes a snack. This is telling you that she likes sandwiches. She prefers to make her own meals. You're going to monitor safely during preparation and assist as needed. They can still cook. They can still do a lot of their things. So that you're just there for assistance in case they need to get a pot or something out of a cabinet. If you need to cut or peel up potatoes, open a jar. You don't even have to cook the meals. They can be Meals on Wheels are delivered to a lot of our clients. You can just help heat it up. You can go through the drive-through, and that is considered making a meal. So you don't actually have to do the meal preparation yourself. So you can initial if she ate something. The next one is going to be bed making. Some of them sleep in a bed. Some of them's on a couch or a chair. It will tell you if they're going to want their linens changed weekly or if she prefers to make her own bed. And you're going to monitor her safely that she does this. And so you can initial that you did it. Now after the blue line, the laundry, the vacuuming, the mopping, the dusting, and the straight, that's what we consider the household chores, okay? So everything below that is if you have time and you're not traveling and it's the day of the week that the task is assigned, then you do it, okay? This is the part that gets different every day. So here we have laundry, and it's wash and dry, fold, and put away. So if you just wash them, and she will dry them later, or if you just folded laundry and put them away for her, you can still mark it if it's due that day, which is Wednesday, okay? And PRN. So that means if it's Monday and she had laundry to do, you could do it and initial it, okay? The next one's going to be vacuum or sweep, and that can mean carpet or linoleum. You can sweep the carpet. You don't have to have power. A lot of times when the power's out, they'll say they can't, sweep. I just want to know that you're sweeping the dirt away, whether you're vacuuming or sweeping. And it's Monday and Friday, and as needed. So on Mondays, you're to do vacuuming, okay, and Friday, and any other days of the week that she needs it. Same with mopping the linoleum areas. And she wants it done Monday and Friday and as needed. So if today is Monday and you're working, you would be expected to initial mopping. The next one is going to be dust, and it's general dusting of furniture. Okay. She's wanting it done on Tuesdays, Thursdays, and as needed. So if you're working on Monday and she doesn't need it, then you would just leave it blank. The next one is going to be straightening, and this is a daily task for all the caregivers, and it's her specific request is taking her trash out Tuesday evening to the curb and bring it back Wednesday morning. And you're going to do the kitchen, you're going to do dishes and put them away. The bathroom, you're going to scrub and wipe down the toilet and sink and the mirror. And those are daily tasks unless you're doing errands out of the home, and then you wouldn't do them.